Hi, Dr. Marshall here at Parisville Wellness. The question I often get is who can benefit from chiropractic care? And the answer is everyone. I've adjusted, babies out of the womb. Actually, the earliest I adjusted was about 4 weeks. And then I've adjusted some patients in their 80s and 90s. So what's going to help you is getting stress off your nervous system. So your nervous system is what controls everything in your body. And it's encased in bone in your spine and in your skull. So you want your spine to be aligned properly. You want the stress off the joints, which eventually takes the stress off of your nervous system and allows all that communication from your brain to go where it needs to go properly so you can express health the way you need to. Now for young infants and children, sometimes they get ear infections, sometimes they're colicky, sometimes they have torticollis. Those are things that are going to interrupt their ability to sleep and to thrive and grow. So you take the stress off their joint. Most of the time with a young infant, you're just moving the bones in the upper part of the neck right or left, because as you're young, you have eustachian tubes that are straight, and then that's why they get ear infections, because it doesn't drain. As we age, our head grows bigger and then those point down and they drain, so that's why you really don't get the ear infections as you grow and get older. But for a child, that can be devastating. Now, if you take antibiotics, that increases your chances of getting those ear infections by 4 times. So come in, get those babies checked and adjusted. Also, they may not be pooping properly, so they may have some stress on the sacrum. There's also a lot of trauma in the birthing process that puts damage, micro tears in the ligaments in there. So you want to get that checked and corrected as well. Now, as you age, we're moving, we're constantly stressing on our body. So you want to make sure your spine has the proper alignment, has the stress off of it, so that you don't further damage that as you age and get the degeneration and arthritis in there. And if you do have arthritis, we can also help with that. Motion is key for that. And you want to get some exercise, get the motion, the joints, take the stress off of there, which increases your chances of not having the further degeneration down the road. Now, I can't reverse time and I can't reverse the degeneration, but I can help your spine stay mobile and keep the stress off it so you don't further degenerate and get those lasting damages in there. And then, so how often do I need to come in? A lot of people say, well, I don't want to come in because you're going to make me have to come in for the rest of my life. Well, you're going to go to the dentist for the rest of your life, right? So your spine is more important than your teeth, because your spine sends energy into the rest of your body. So you want that energy to be restored everywhere so you can express health for your entire life. So that doesn't mean you're coming in 4 times a week. Early on now, some patients come in 2 to 3 times a week because they're inflamed, they're in a lot of pain, and we're trying to get them out of that. Now, our goal is to get you functioning at your highest level, and then the pain will go away eventually. And then some patients will gravitate or graduate to a 2 to 3 times a month. Sometimes it may be just once a month is sufficient for you. So it's all based on your x-rays, based on your symptoms, and based on the exam and evaluation that we will do here for you. And then we will go over that. Next question I get is, okay, well, what does insurance cover? Everyone's different. A lot of your insurances will cover some care. Our office will check those benefits for you and let you know what the insurance company covers and then what will be responsible for you. But you may be required to pay it all yourself, because some insurances just don't cover that. But we also offer in-house financing to help you with that. The best thing to do, though, is to come in, help us evaluate, check you out, see what you need as far as care, and then we can help you with the financing piece of that.